Because we were just not sure like if planes are good for my wife at this stage.
I think it's safe to travel up until your 3rd trimester.
But it'll be like a few days before the 3rd trimester. That's what we're...
As long as you don't have any health concerns.
Okay.
Yeah. Are you guys traveling like...
Well, we want to go to Alaska.
Oh, okay. I was thinking like don't go anywhere like...
Where there's like mosquitoes.
mosquitoes.
So you're our midwife's assistant?
Yeah, I'm the medical assistant.
Okay.
So yeah, I help out with the midwives, just doing vitals and assisting with procedures and stuff.
Nice.
Yeah.
So you're our midwife.
Yeah, that's a good way to put it. Alright, so
normally it's 25-35 pounds is the normal.
it all depends. Did you get your after visits from your first visit? It all depends on what your BMI is, and that depending on your BMI, like if you have a really healthy BMI, then yes, you'll gain 25 to 35 pounds. So I'm gonna assume you probably have a really healthy BMI. So yeah, you're supposed to gain about 25 to 35 pounds.
Yeah, I already gained
14.
14 pounds.
Yeah, 14, 16.
Yeah, I think so.
Yeah, I know so.
Okay.
Yeah, you're good.
Halfway.
I'm good. I'm the one that has.
You got all the knowledge.
I'm the one that remembers.
Alright, so I'll grab Brenda for you guys, okay?
Yeah, thank you.
Alright, thank you.
See, I told you were doing good, babe.
So that's that question. What else? What else is a question?
Well, we had our trip answered, so...
Yeah.
So we had asked the midwife,
the MA.
the MA.
I forgot.
And we had a concern because my wife wants to go to Alaska. And we're like, well,
March 17th.
by the time we come back, it'll be like 2 days before her 3rd trimester.
That's fine. The next month is when the baby's brain really starts to develop. So food that's really helpful to eat right now would be, do you eat fish at all?
Yeah, I do.
So fish is
Do you eat
really...
fish?
I do. I like fish. I like
Under the
salmon.
bus here, I think.
You don't eat
You're not
fish.
letting her get away with anything. If this would be a great time to start eating fish, if you don't, or there's probably fish oil in your.
Oh yeah, I have it. I include that
Great.
with my prenatals. I have vitamin D, fish oil, and
Perfect. So that's great for brain development, and also leafy green vegetables are really helpful for that. So if you kind of focus your diet around those kind of things,
leafy green and fish.
so
Okay.
like sweets and junk food and carbs.
You want to ask about the doula?
Oh yeah. About my birth plans. I don't know when am I supposed to write that.
Did you get one?
No.
Okay.
No.
All right. So there's no whatever you want, just before you have the baby.
Okay.
This is kind of like describes a lot of how we look at it. This is
Okay.
kind of a pain scale chart that they talk about. The top extreme, like the top thing is you want an epidural even before labor begins. That's not an option. The bottom one is you decline medication even in a C-section. It's not an option. You're probably in the middle somewhere.
Yeah.
And so it's just kind of a way to gauge where you are. And then if you turn to the second page, this is super basic. What's important to you? You know, what do we need to know to take care of you? How we approach medication, if we mention it or not. And then,
Am I gonna be giving birth here? Okay.
yeah.
Okay.
Have you taken a tour of? Oh, so I would suggest you take a tour.
One other thing too is that she was thinking about water birth or what was it?
That's not possible.
We don't do water birth, but you can labor in the tub, and when it's time to push, we just have you get out.
Oh, so
There's a tub here?
Yeah.
Oh, see, there you go.
Oh, okay.
Because she was really kind of looking forward to do the tub thing.
Pretty awesome. Yeah.
Yeah.
And then
Okay,
it's
well, then I guess that solves that problem
Do
then.
you have a tub here?
So you'll see it on the tour.
Oh, okay.
Does she have to reserve it ahead of time, or
Well,
is it just like?
There's one for the floor. There's 8 labor and delivery rooms and 1 tub, which sounds like it might not work, but it almost always works out fine because you can't be in it if you have an epidural, and like 40% of our patients have epidural, so they're not in it. And different people are at different points in their labor when they're here, so.
Yeah. Okay.
Tub is, so there's an IV medication called fentanyl for pain relief that we can give in an IV. It lasts about an hour. It's a narcotic. It kind of like relaxes you, makes you feel a little woozy. People have said the tub is just as effective at pain relief as fentanyl. But everyone's different. So people get in and they're like,
But you don't labor in the tub, right?
You can.
Oh, you can?
It can be enough hours.
Okay.
Yeah. Put in there hours.
I mean, you can try if you don't like it, babe. You can just peace out. You know.
I'm gonna ask Haley, our doula, like how she can assist if we do. Because she did ask me if I can do water birth. like I said, I don't think they do that, you know.
Yeah.
Well, they don't do water birth, but they do the soaking.
Yeah, everything into the pushing.
Yeah.
Oh yeah, the doula. Yeah. So we're thinking her to be here. As soon as we come here, like we're gonna call her. She'll be here.
Can she have? Can we have permission to have our doula inside the
room?
The room, the birthing room?
Oh yeah.
Okay,
that's
cool.
That's what you're paying for. That's what they should.
Yeah.
That's exactly where they should be.
Yeah, but I also wanna my sister also.
That's fine. And so we tell people to call when they're contracting every 4 minutes for an hour.
Every 4 minutes.
Yeah.
Okay.
For 1 hour.
411 we say, and the contraction should be a minute long.
A minute long.
Yeah.
Okay.
You'll get this all right now. It's a lot to remember.
Okay.
Before that, though, that's when you're about 37 weeks. Before that, if you're having contractions that are every 10 minutes, then we'd want to know about that.
Before my 37th week. Okay.
Yeah, anytime now. So
Okay.
contractions may feel like just getting really tight. They might be painful. They might not have any pain with it. They might have back pain. They might not. And it's totally normal to have irregular a few times a day. That's very normal.
Okay.
But if they're regular, then you gotta call us.
Okay.
Or if your water breaks, of course, call us.
Okay. I have another question. Is it advisable for me to eat a meal before labor?
Eat throughout labor as much as you can.
Oh, really? Because they said just do ice chips and.
That's the old rule.
Okay.
And if you have an epidural, then you can only have liquids.
Mhm.
But in labor, you should be nibbling on food. You might not want to eat, and a lot of people throw up in labor, so don't eat your favorite foods. They won't be your favorites anymore.
So don't bring Chipotle.
Don't do that. No, that will not be good on the reverse trip. Mild foods, nibble. It's good to do like sugary stuff, like honey or gummy bears, that kind of stuff.
Oh, you like gummy worms?
Good energy boost.
Okay.
So.
Okay, so it's okay then.
Yeah, it's good to do.
Okay.
But nothing, no, don't eat a really big meal.
Just a snack, something to nibble. The thing is, sometimes I see the baby come out really fast, and then sometimes they're staying crowning for so long, like 6-7 minutes. I don't know what's the likability of.
Usually the ones that come out really fast, it's their second or third baby.
Oh, okay. So I will.
First babies.
Oh, okay. Okay.
But
It's got to stretch those muscles.
The ring of fire. They're saying the ring of fire.
You might know more than it's helpful.
Hey, you know what? It's good though. I mean, that's why I love the internet, is because you're able to see all these other people's experiences and then kind of make an guesstimate.
Yeah. Well, remember we saw the documentary that she did IVF.
Yeah.
She was fast too. Like it was.
I mean, sometimes, yeah.
But does it like matter, like your bone structure or whatever?
A little bit, and a lot with the baby's position. So if they're in a really like good, straight, tucked in position, it's a lot more effective than if they're just even a little off. Like instead of being like this, it just takes longer to push. So
okay.
A lot of things are out of your control.
And like also I noticed like they don't get tangled, by their placenta, right?
The umbilical cord?
Yeah, because sometimes I see in a video like they have to like wrap.
That happens quite often, and usually it's not a big deal at all.
Okay.
We'll just deal with it when it comes. Like, you don't know. It's like you're.
No, I just want to know if it's a normal occurrence. Or
It's really normal. A lot of people are worried about that, and it's really normal. It's something that we know to look for at delivery.
Yeah.
You can't really see it ahead of time. So
Yeah. And then how long does it usually take before the entire umbilical cord comes out? Yeah.
Up to 30 minutes is normal.
30 minutes.
Usually
and it
just
just
a few minutes.
ejects by itself.
So you get some cramping, and then
It just comes. But I know it's like once the moms are holding the babies, they don't really notice it coming out.
You're like so busy falling in
Yeah.
love, but
Yeah.
I don't know.
Yeah. I can opt to like no induce, no.
It depends. Like, well, we would check in and see what's going on at the end of your pregnancy and kind of talk about what's right for you.
Yeah, I kind of want. My epidural is fine if I can't really. I'm gonna try to hold off on epidural as much as I can, but I don't really want pitocin.
Okay.
So.
If everything's normal, like you're just normal, healthy all throughout pregnancy, we offer induction at 41 weeks. But you don't have to do it. We really want you to have your baby by 42 weeks. So.
42 weeks.
That's our.
Yeah, I understand. Like after for the 40th week, I will understand. But while I'm in labor like before, I kind of don't want Pitocin.
I agree with my wife. Like, yeah, the less harmful chemicals we can add to it, the better.
We should talk about breastfeeding.
Okay.
Are you planning to breastfeed?
Yes.
Okay.
Yes.
I'll just explain.
Oh, I don't have a pediatrician. Is that what you're talking about? Pediatrician?
Mm-hmm. Yep.
Yeah.
So who's the pediatrician going to be? If you have any specific concerns about
Do
breastfeeding.
you have like recommendations?
I think that's also on your after visit summary today.
Oh,
We recommend exclusive breastfeeding for the first 6 months.
okay.
Probably maybe what you're planning anyway, I'm guessing.
Yeah, well, he bought like a bunch of formula.
Well, I didn't buy a bunch of formula. I just bought in case.
Right, and there are situations in which it's important to supplement, and the pediatrician will let you know that, like if the baby's not growing.
When do I start seeing once the baby's out?
Yeah, so you just pick one, and then after the baby's born, we call and tell them they have a new patient.
Okay.
And then if your pediatrician doesn't have privileges here, the pediatrician that's here will see your baby
Okay.
and send all the records to the one that you have.
Okay.
So your next visit, we're gonna be screening for diabetes. Have you
Okay.
heard about this?
Yeah.
Okay.
Yeah. For gestational
Yep.
babies. Yeah. Okay. Good.
It's a 2-hour test, fasting, so no eating after midnight. It's kind of miserable, to
Nah.
just be honest.
Yeah. No adding. No. Oh, that's fine. We did it in IVF. And
She'll
we
just
had-
wake
Oh,
up
great.
late.
And then, well, we want you to come, so you come in, and whatever, you have to schedule it. They take your blood fasting, they give you this drink, the glucola, and then an hour after that, they take your blood, another hour after that, they take your blood, so you're here for 2 hours.
Oh,
And then you
okay.
would see the midwife in between.
Oh, okay. And that's gonna be in 6 weeks.
It's about 28 weeks, so yeah, 5 weeks.
All right. After our Alaska thing.
Yeah, something like that, for about 5 weeks.
Mm-hmm. Okay.
And we also will check for anemia at that point as well. So that's
Okay.
coming up. And then did somebody talk to you about when patients have IVF that we do extra testing at the end of pregnancy?
No.
We offer extra testing. So when you're 36 weeks, we offer additional monitoring.
Mhm.
There's a slightly higher statistical chance that there could be a placental problem with IVF. Almost always it's fine. We're talking about really, really, really small numbers.
Mhm.
But we offer non-stress tests, which is listening to the baby's heart rate, and fluid check,
Mhm.
an ultrasound to check the fluid level. Those are all signs of placental functioning
Okay.
weekly at 36 weeks, just to make sure things are fine.
So I just come in like after my I don't know how many weeks, but I come in every week after my 36th week.
Yeah.
Okay. So
Exactly.
Okay.
Sure, why not,
Yeah.
right?
Yeah.
It's non-invasive.
Mm-hmm.
Okay.
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 All right. Well, I want to listen to your baby.
Okay. Yeah. Sure.
All right.
I don't think I can sleep with that.
Oh.
Yeah, that sounds great. 152. Sound good to you?
Yeah.
Sound good to you?
Sounds good.
Sounds good to me too. Beautiful.
152.
So like averaging around 150 is kind of going up and down a little, which is great.
That was so. Is she low now, or is she's trying to come up?
I don't really, can't feel her position that well. She is, I think she's on the lower side. She's like,
But it's better, right? If she's lower, it's easier for me to give.
at this point it doesn't matter. There's a lot of room, and it's usually late, like 34-ish weeks is when they kind of start settling into position.
Oh, okay. So she's still gonna be moving from this position.
She's probably flopping around and rolling around. Yeah. You're in good shape. Some kind of childbirth class. Oh, we also through Swedish offer a mindfulness-based childbirth class, which is really great. It's also geared towards people that are planning no medication, but it's a lot more like meditative techniques and like pain management.
Can you write down those classes?
For
I'm gonna
sure.
forget.